Hey everyone, my name is Josh. I'm a student at the University of Buffalo studying occupational therapy. In this video, I'm going to be demonstrating some manual muscle techniques for the wrist and the hand. Manual muscle testing is a technique used by therapists to assess muscle function. These tests are typically graded on a scale of 0 to 5, with 0 being that no muscle contractions are felt at the palpation site, and 5 being able to demonstrate the end position against strong resistance. Manual muscle testing is used in a variety of different patients, including musculoskeletal injuries, cardiovascular, pulmonary, and neuromuscular diseases and disorders. Okay, we're going to start with wrist flexion and radial deviation. The prime mover for this movement is the flexor carpi radialis. To start, you're going to have your patient seated with their arm rested on a table. The forearm is going to be supinated, and you're going to have them extend their wrist while ulnarly deviating. The palpation for the flexor carpi radialis is going to be on the anterolateral aspect of the wrist in line with the second web space. So it'll be right along here. So to start, we're just gonna screen our patient. We'll stabilize right on their forearm. So go ahead and go here and then flex and radial deviate. Good, and you can rest. And then finally, you're going to be applying resistance. The resistance will be at the distal end of the wrist over the thenar eminence of the lateral aspect of the palm. So you'll be coming in right here. And you'll have them do that 3 times. Go ahead. Go ahead. Good. And one more. Good. Substitute movements for this position include flexion of the wrist using the palmaris longus or the flexor carpi ulnaris muscles. Okay, now I'm going to demonstrate wrist flexion with radial deviation, the gravity eliminated. The prime mover for this movement is the flexor carpi radialis, and the palpation for this will be on the anterolateral aspect of the wrist in line with the second web space. So your patient's start position is going to be sitting with their elbow rested on a table, and you're going to have them slightly pronate their forearm, extend their wrist, and radially deviate to start the position. Ulnarly deviate. And then the movement while palpating their flexor carpi radialis is going to be flexion with radial deviation. Go ahead. And back. And one more. Good. Okay, next we're going to demonstrate wrist flexion and ulnar deviation. The prime mover for this movement is the flexor carpi ulnaris. To palpate for the flexor carpi ulnaris, it'll be on the anteromedial aspect of the wrist, proximal to the pisiform bone. So her pisiform bone will be here, and we'll just go proximal to that. You can feel the gap between the ulnar styloid and her pisiform bone. The start position is going to be seated at a table with the forearm supinated. The wrist is going to be extended in radial deviation to start, with the fingers and thumbs relaxed. So to start, we'll do the screen movement while stabilizing her forearm. Go ahead. And here we're just palpating to make sure the muscle activates. Okay. And then when you go to apply resistance, that's going to be over the hypothenar eminence, so on her pinky side. And that your resistance is going to be in wrist extension and radial deviation. Substitute movements for this include recruitment of the other wrist flexors, the flexor carpi radialis, palmaris longus, and flexor digitorum superficialis, as well as flexor digitorum profundus. Okay, now I'm going to demonstrate wrist flexion with ulnar deviation, gravity eliminated. The prime mover for this is the flexor carpi ulnaris, and palpation is going to be on the anteromedial aspect of the wrist, proximal to the pisiform bone, so right down here. Your start position for this movement is going to be have the patient sitting with their elbow supported by a table. Their forearm is going to be slightly supinated with their wrist extended and radially deviated. So extend and bring to the thumb. Okay, and then when you're going to have your patient flex their wrist and ulnarly deviate while palpating just below the pisiform bone. Go ahead. Okay, again. Go ahead. Good. Okay, next we're going to demonstrate wrist extension with radial deviation. The prime movers for this movement are the extensor carpi radialis longus and extensor carpi radialis brevis. To start, you're going to have your patient sitting at a table with their wrist hanging off. Your forearm will be pronated, and the wrist will be flexed with ulnar deviation. The palpation for the extensor carpi radialis longus and brevis are at the base of the second metacarpal and third metacarpals. So they're going to be right, here's the second and third, they're going to be right down here. So to start, you'll just have your patient do the movement in a screen position while stabilizing their forearm. Good. And then bring it to the flexion with radial, or extension with radial. Good. Relax. Okay. And then to apply resistance, you'll apply resistance right over the dorsal aspect of the second and third metacarpals. So I can palpate here with my thumb as well as apply resistance down here. Go ahead. 1, 2, and 1 more. Okay, rest. Substitution for this movement include the recruitment of any of the other wrist and finger extensors, including the extensor digitorum communis, extensor indicis, extensor digiti minimi. The patient may also use the extensor carpi ulnaris. Next, we're going to demonstrate wrist extension with ulnar deviation, gravity eliminated. The prime mover for this is going to be the extensor carpi ulnaris. To palpate for extensor carpi ulnaris is going to be on the dorsum of the hand, proximal to the fifth metacarpal, but distal to the ulnar styloid. So right in down here. Your starting position for this movement is going to be having your patient seated with their forearm in slight pronation, supported on a table. They're going to begin with their fingers and thumbs flexed. Their wrist is going to be flexed as well and radially deviated. To perform the movement, you're going to stabilize the patient's forearm. Go ahead and begin in flex and bring it to your thumb. Good. And then now palpate, and we'll bring it back. Go back forward. Go ahead. Back forward. Come back. Good. And substitute movements for this include the recruitment of the long finger extensors, extensor digitorum communis, extensor indicis, extensor digiti minimi, as well as the utilization of extensor carpi radialis longus and brevis. Next, we're going to demonstrate metacarpal phalangeal extension. The prime movers for this is extensor digitorum communis, extensor indicis proprius, and extensor digiti minimi. Their palpations can be found at, for the extensor digitorum, it's going to be on the dorsum of the hand, proximal to each of the metacarpal heads. So it's going to be right across here. And then the palpation for extensor indicis is medial to the extensor digitorum tendon of the index finger, so it'll be in here. And then the palpation for the extensor digiti minimi is lateral to the extensor digitorum tendon to the little finger, so it'll be on the lateral side here. So to start, you're going to have your patient have their elbow rested on a table with their wrist slightly hanging off. Their forearm is going to be pronated with the wrist in the neutral positions, and have their IPs, their interphalangeal joints, flexed. So to start with your screen movement, you'll just have your patient start in a slightly flexed position and flex their metacarpophalangeal joints. Good. Go back down. And again. And I can feel her tendons of her extensor digitorum right across here. So when you go to apply resistance, the resistance is going to be on the dorsal aspect of each proximal phalanx of each finger, right across here. And you'll have your patient extend her MCPs 3 times with greater resistance each time. Go ahead. 1, 2, 3. Good. All right, next we're going to demonstrate metacarpophalangeal abduction. The prime movers for this are the dorsal interossei as well as the abductor digiti minimi. For palpation of these muscles, the first dorsal interossei can be palpated on the radial aspect of the second metacarpal. The other remaining interossei are too deep to be palpated, and then finally the abductor digiti minimi is palpated on the ulnar aspect of the fifth metacarpal. For your start position, you're going to have your patient seated with their forearm pronated on a table. The wrist will be in neutral with their fingers extended and adducted. So to begin, the movement for this, you have to do a few different steps because you're trying to get adduction in all of the fingers. So to start, you're going to test the middle finger, the first interossei. You'll stabilize the other fingers and the thumb, and have your patient abduct their index finger. Go ahead. And then you're going to have them move their middle to their index, and then have them move their middle back over to their ring so that you're abducting in both directions. And then you'll next have your patient abduct their ring finger, and then finally they'll abduct their pinky. Good. For the actual muscle strength testing in this, resistance will be applied on the proximal phalanx of the digits. So we'll start with the index, and we'll move the index to the thumb while applying resistance against it. Go ahead. And resistance and adduction. Back to the middle. One more. Two more. And one more. Good. And now we'll bring the middle to the index. Go ahead. Again. One more. Good. Other way. To the ring finger. Again. And again. And then we're going to bring the ring finger to the pinky. Go ahead. Back. Again. And again. And then to test for the abductor digiti minimi, we're actually going to have our patient pronate their forearm, and we're going to stabilize right along their thenar eminence and palpate the lateral aspect of the fifth metacarpal. Go ahead. Abduct your pinky. You're going to stabilize the rest of the fingers as well. Go ahead. 2 and 3. All right, next we're going to demonstrate metacarpophalangeal adduction. The prime mover for this movement are the palmar interossei, and the palmar interossei are too deep to palpate. To begin this position, you're going to have your patient seated with their forearms supinated, supported on a table. The wrist is going to be in neutral, and the fingers are going to be abducted. Go ahead and abduct. The movement for metacarpophalangeal adduction is going to be, you're going to stabilize their wrist and have them bring their index finger to their middle finger. Good. And then their ring finger to their middle finger. And then their pinky to their ring finger. Okay, and that was the screen to make sure that they could do it. Now to apply resistance, the resistance will be applied to the proximal phalanx of the digits being tested, and the direction will be in abduction. So again, we'll have you fan out your fingers, stabilize here, and then I'll apply resistance in abduction. So bring the index to the middle. 1, back out, 2, back out, and again, 3. And then leave that here. We'll bring the ring to the middle. Again. And again. Good. And then the fifth digit to the fourth. Go ahead. 1, 2, 3. Good. And finally, there are no substitute movements for MCP adduction.